I'm Jane at the Results Lounge. I am here today with Abby, who is our lovely little volunteer model. Abby is heinously old, as you can see. She's not, she's young, she's 21. So we're going to be doing something a little different today. It's called Prejuvenation. So we've all heard of rejuvenation when you're trying to fix the problem after it's occurred. Prejuvenation is the prediction of having an area that is troublesome or unwanted lines, wrinkles, and kind of approaching it before it becomes an issue. So Abby does not like how she can see kind of some horizontal lines here. I pre-marked her to show you some of the muscles and how they kind of work. So this is the frontalis muscle. It's two separate pieces here, but it can fuse together on people. It cannot fuse. You can see her lines are a little bit kind of staggered, telling me the muscles moves a little bit different on one side than the other. So go ahead and raise up your forehead, and I've marked the border, and that's kind of what makes the widow's peak for some people is when they have a lack of muscle in that area. So it kind of comes with their hairline, and then you can see lines in the area. And then she even gets lines right here. So her frontalis muscle comes down quite low and is active down here. So I'm probably going to stay above this area for her. If I put any below that, it will just be a tiny little dot to keep it from pulling up on the sides. And then I will show you kind of, and I'm not going to go for a full adult strength, which can be 10, 20, you know, the forehead has a huge variability. I'll probably start at about 6 to 8, and I'm just going to kind of spread around her forehead. I would prefer to do smaller injections with a little bit more of them to get a little bit more even spread. And then the other area here, some injectors will, if you just complain of these lines here, they will inject the frontalis, that's it. I do not do that on most of my clients because if you notice here, it appears a little bit thickened here. She doesn't have lines there where I've put the marks. She has lines here when it rests, but not here. But I still want to pay attention to this because if I smooth this out so it's nice and shiny without any of those little lines or muscle pull, and I leave this muscle complex, the glabella, which is the procerus and these corrugator muscles here, if I leave that intact, but smooth this out, she will have smooth and then kind of a Vulcan head, like a really thickened area here. And that's kind of a look people don't identify what it is. They just think they look freaky when they see you and you're nice and smooth and you got this heaviness here. So I counsel my clients on why I don't want to do that. This is a more expensive area to treat. So if people just want this, I just don't like to do it. There's a couple of clients I've had who literally have no action in their glabella. In that case, I will do it. But I do not want somebody walking around looking like a Vulcan with my name on it. So she likes it. Abby's requested the Vulcan today, so we're gonna go for it. And so I outlined the frontalis muscles here, and then this here, make angry face, kind of, there we go. So then procerus here in the middle, and she's got a little split in hers there, so right in there, and then down into here. And then the corrugator muscles are right in here. You can see kind of how they pull. Do it one more time, and she's got like a tail that comes over here. So we'll just kind of layer back a little bit and hit this area here. And I'm not going to go incredibly heavy on that either. Now, an adult dose frequently is 16 to 30, anywhere in there. I'll probably start out around 12 to 14 with Abby in here just to lighten it up. I don't want her to be frozen. I want her to move, have expression. I just don't want her having lines at rest. That's what we're trying to avoid. And then just for kind of demo purposes, I looked at the rest of her face. And this over here in the crow's feet is a lot more preventative for people. Not only with the lines over here, but also, smile real big for me. This circle muscle I lightly outlined with the marker here is a sphincter muscle, just like around the mouth. So it pulls in and together. And so long, after having this smiling a ton of times a day, a lot of people will kind of get that fat pad herniation down here. And it seems to have a little bit of a correlation with having the real smiley eyes and kind of hyperactive muscle in the eye. So hopefully by doing a little bit of prophylactic treatment over here, we're not pulling as much to the side to create kind of a herniation. Now, sometimes it'll still happen from a deeper fat pad or from genetics, lifestyle, those things, but hopefully we can prevent a little bit of that pull from treating just a couple units over here. And then go ahead and give us a nice big smile. You can see on Abby, and then rest your mouth again. She has beautiful lips. She has a nice Cupid's bow here. And she has a nice, pretty close to a 1 to 1.6 ratio, maybe a little bit smaller on the top than a 1. But when she smiles, these tubercles of fat on the sides kind of go away. They curl up with that muscle. So by coming right in here and hitting just a couple units there and there, I can keep that down just a little. So smile again. So it will show a little bit more of that lip. Now that is not a lip augmentation. That is not filler. I'm not putting anything into her lips to make them bigger. It will not duck lip her. It can treat something called a gummy smile, which Abby doesn't really have. You can see a little bit of the gums when she smiles, but it's not full on a gummy smile. I wouldn't call it that. It's just to give her a little bit more. If she wanted the lip flip, like some young girls do, I'd be a little bit closer down here to the lip and do a couple more little injections, because you can get that curl to come up again in that case by treating this orbicularis oris muscle that goes around the mouth. That's also a great treatment for the vertical lines females get with age from a hyperactive muscle. So, and those are similar to crow's feet over here, but they're on the mouth. So you can treat that also with some Botox. Lower face Botox lasts normally 6, maybe 8 weeks. It's a much smaller amount, and we're a lot more active on the bottom of our face too. We're always talking, chewing, making expressions, doing everything down here. So we really burn through it. And really, when you're doing around the lips or in here, I'm going to be using a total of 4 units. So it's a very low, whereas up here, you can go 14, 24. So this up here in the upper face, from the eyes above, when you're doing crow's feet, glabella, or frontalis, you can usually get about 3 months out of it. All right. Okay, so we're going to go ahead and get started with the injections. I myself always start with the glabella. So I just kind of pinch here, and I've already marked her up. And that's about the worst of it, Ab. So just a little in there, a little in there. You can hear a little noise, that's normal. And I just put a little pressure on it like that. Doing okay?
Yeah.
Excellent. Is it painful?
Not bad.
Okay, good. And then I like to do kind of the same with my corrugators here. I kind of put a little bit like so, and then go in, a little bit up angle, and I like to guard the orbital rim there. And you always want to have your patient with the legs out like this. I've had a couple passer outers in my day, so if that happens, you gotta kind of flip their feet up. We're prepared.
I won't pass out. It's not
Good.
bad.
Don't worry, I'll wake you back up. So Abby and I kind of already talked about post-care. Afterwards, she's very fit and is all into exercise and stuff. She's not going to want to do any hardcore exercise the rest of the day. She can do some light stuff. For about 4 hours, they recommend that you don't lay down. So raise up for me here. Raise your brow up. There you go, and relax it. So we want her to not be going home and laying down for a nap just right afterwards. Again, for a couple of weeks, we want to avoid things like massaging the face, microneedling, anything that manipulates the muscles in the face. Great, Chief. You're almost prejuvenated. Raise up over here and relax it. And so if we end up needing a touch-up, we're going to do that in about 2 weeks. So what Abby can expect when she leaves here is to maybe have a little bit of redness. Sometimes you'll have little bumps called Botox horns raise up on the head, but sometimes just a little redness. You can relax it. And she's not going to notice anything different today. Now, day 2 to 3, 3 to 4, she'll start to recognize a little bit decreased movement, and that's going to continue to improve over the next 7 to 14 days. So when I need to go back and add a little bit, if I need to touch up, that's completely acceptable. Less is best. You can always add with Botox. In 2 weeks, I can always go up. If she has a little activity still somewhere, or if she has a little flare of movement where it just didn't uptake quite as much, or if I used a little bit less here or there, it's not a big deal. You add a little bit more in 2 weeks and get the effect you want. Now, if you go in and go heavy, you cannot undo it. Botox does not have a reversal agent. You just have to wait for it to wear off, which is a good and bad thing. There's really not a lot that you can do with Botox that's a permanent bad side effect, but you do have to be mindful that the person would have to live looking a certain way for a couple months. Generally, the bad side effects or unwanted outcomes wear off really quickly. And in somebody young and healthy like Abby, it's a pretty low risk because she has nice tight skin up here. This is one of the areas that you bruise most easily in, but generally in good lighting and kind of spraying the skin apart, you'll see vessels in there, but you know, anybody can bruise at any time. And so we're just gonna do a couple here. Right in this area, smile for me. That's right where that lifts up, and relax it. And so I just go like this, and a little pokey. Great job, Ab. Done with that one. And smile, and relax. And the last one for you. Well done.
All right.
You did a great job.
Thank you.
So in total, we just used about 24 units total. And that's for glabella, frontalis, a little bit in the crow's, and for this smile. So in an adult female, it's going to be a much heavier dose than that. So you're going to go home, not lay down, not rub your head, not put a hat on, anything like that. Just kind of take it easy for the day. Normal skincare tonight. You can wear normal makeup. It's always best to wear a good either oil-free makeup or cosmeceutical brand, the Glow Minerals, Jane Iredale, when you have had injections. So the rate of infection is always possible with any injection. It's very low in this case. We do cleanse with alcohol, use all sterile needles and products, and the face is so incredibly vascular that the blood supply is amazing. So you get a little nick, it repairs very quickly, and any type of infection that would get detected from it is fought off pretty quickly, while the lacerations to the face and head don't even get treated with antibiotics that are pretty big. So that being said, these little tiny nicks we do probably shouldn't do too much. And did you have any questions, ma'am? All right, so we'll set up a follow-up appointment for about 2 weeks from now, and you'll have my number in case you need me for anything, any questions you forgot. Thank you, Abby, again for coming in and doing this. If you'd like to get some Botox, filler, any of the body sculpting here at the Results Lounge, all consults are free with me. Give us a call at 765-701-0249, or you can look us up online, info@theresultslounge.com, or on Facebook.